Occupational English Test. Listening Test. This test has two parts. Part B. In this part of the test, you will hear a talk on naturopathy. You will hear the talk once only, in sections. As you listen, you must answer the questions in the spaces provided on the answer paper. Turn over now and look quickly through Part B. You have 1 minute to do this. You may write as you listen, and there will be pauses during the talk for you to complete your answers and to read the following question. Remember, you will hear the tape once only, and you should write as you listen. Now read question 1. Question 1 has been done for you.
Hi, I'm a naturopath and I'm going to talk a little bit about what I do as a health practitioner and how our profession fits into healthcare in Australia. To begin with, I'll just explain what naturopathy is, how it all started, and I'll also outline the main principles and philosophies behind our profession. I'll then speak a little bit about the particular area that I specialise in, which is women's health and fertility.
Now read question 2. Now listen and answer question 2.
Firstly, what is naturopathy? Well, it's a type of healthcare based on the philosophy that the human body has the innate ability to heal and repair itself. When you look at the human body, you'll notice that we are designed with the ability to regulate almost everything, and each part of our body works in unison with the other parts. So naturopaths never isolate one particular part of the body when treating illness. We always consider that each part is influencing another, and therefore we treat the whole person. So in order to assist the body, the mind and the spirit to reach and maintain balance, we promote healthy eating, healthy lifestyle. We also use food as medicine, as well as treatments such as herbal medicine and various other modalities specific to the needs of that individual. So there are 5 main principles of naturopathy. Firstly, we aim to treat the cause, not just the illness. Secondly, we do no harm. Thirdly, practitioner as teacher. Fourthly, we treat the whole person as an individual. And 5, prevention is better than cure.
Now read question 3. Now listen and answer question 3.
So I'll just go through and speak a little more on each of these in a bit of detail. Firstly, to treat the cause. Now, the role of the naturopath is to determine not just what is wrong with the patient, but more importantly, why it is wrong. We focus on the cause of the illness, not just the illness itself. In particular, if a patient has a chronic or recurring illness, which is often the type of patients we see, we really need to determine why it is that they keep getting ill. Is it something to do with their diet or their lifestyle perhaps? Or even their emotional state? Perhaps their occupation or even their outlook on life? This is primarily what differentiates us from mainstream medicine. We emphasise that it's essential to encourage health, rather than just treat the symptoms when disease arises. Now, to do no harm. No naturopathic treatment should ever pose any risk to the patient, and as our name suggests, all our treatments are natural. We believe that healing is brought about by bringing strength to the individual and does not involve any artificially produced drugs that may cause unwanted side effects, and it doesn't involve surgery. Not that we actually have anything against drugs or surgery. In fact, for some people, these treatments are absolutely necessary. The idea for us is to promote health and well-being to prevent disease before it enters the body. So the main tools we use in our treatments are things like diet, nutritional advice, lifestyle recommendations, things like stress management, meditation, exercise, that sort of thing, herbal medicine, vitamin and mineral supplements, and we sometimes use homeopathy as well.
Now read question 4. Now listen and answer question 4.
The third principle is naturopath as teacher. Now, as health practitioners, we recognise the importance of educating people about their own health, because essentially it does empower people to regain responsibility of their own health and incorporate change into their daily life. Considering that so many diseases today are thought to be caused by our lifestyles, it does make sense that individuals become an active participant in their treatment plan. Becoming involved in the treatment improves the patient compliance, and it also assists with positive outcomes and helps people to understand how to intervene or perhaps manage their condition if it does reoccur.
Now read question 5. Now listen and answer question 5.
The fourth principle, to treat the patient as an individual. As I mentioned before, we look at the whole person. So it is considered to be a holistic therapy which not only looks at the patient's physical state of health, but also their mental, emotional and spiritual health. You won't find any generic prescriptions in a naturopathy clinic. Each treatment, whether it's herbal medicine, vitamin or mineral supplements, are all prescribed according to the specific needs of that patient. And lastly, prevention is better than cure. There's been a lot of general belief in the developed world that no matter how we treat our bodies, there'll be a drug to fix us when something goes wrong. Unfortunately, there is no cure or drug for every illness and disease, so many diseases are actually preventable, and we stress the importance of looking towards prevention as a primary form of healthcare and recognising that prevention is better than cure. So we would even perhaps suggest that people see a naturopath for general health even if they don't appear to be ill at the time.
Now read question 6. Now listen and answer question 6.
Now, what types of conditions or patients do naturopaths typically see? Well, most commonly, we're traditionally known to see patients suffering from digestive disorders like irritable bowel syndrome, food intolerances, Crohn's disease, celiac disease, and malabsorption disorders. But we also treat people with disorders related to the immune system, just things like even the common cold to chronic sinusitis, eczema, chronic fatigue, other autoimmune diseases. People also come to see us if they have migraines, anxiety, depression, and any other sort of nervous system complaints are very common.
Now read question 7. Now listen and answer question 7.
But an area that's of particular interest to me, which I've also contributed to research in, is women's health and fertility. So I'll talk a little more about this in detail. Now, the women's reproductive health is a very complex issue, particularly because of the emergence of many different endocrine disorders that can affect a woman's ability to reproduce. Disorders such as polycystic ovarian syndrome, endometriosis and fibroids are becoming more and more common. The reason for this is really unknown, or perhaps they've always been common and people were simply blanketly diagnosed as being infertile. But we're now just learning more about each of these disorders as more research becomes available. My particular experience in treating infertility is usually seeing couples who have been trying to fall pregnant for at least a year and who have been unsuccessful. These people may also be undergoing IVF treatment and have been referred to our clinic by Melbourne IVF clinics who suggest they see a naturopath to optimise the chance of successful treatment. We obviously treat couples who are not undergoing IVF, and the way we treat them is usually very similar.
Now read question 8. Now listen and answer question 8.
So firstly, we ask to see the couple in a consultation together because it's important not just to focus on the female's health, but also the male partner's health also. It'll usually be a long first visit because there is a lot to cover, so usually about an hour and a half. I'll just talk a little bit more about the type of things that we're usually interested in when seeing a couple for fertility. Just in their first consultation, we'll go into the female's health history. We find out in a bit of detail about the menstrual cycle. In particular, we ask about length, regularity, severity, pain, PMS symptoms, all that sort of thing. We need to know about any reproductive problems that they may have had in the past or history of miscarriage, as well as the type of contraception they've used and for how long. These things are really important in establishing any patterns of hormonal imbalance, which is the basic foundation for treating the reproductive system. It's also necessary to find out whether the female is ovulating regularly, and this can be done by educating the patient to look for signs or using an LH surge kit. Some women simply just don't fully understand about the specific time of their cycle that they're most fertile, and sometimes teaching them to track their cycle and the importance of timing intercourse can make all the difference. We also like to know blood test results specific to hormones such as estrogen, progesterone, prolactin, LH and FSH. These blood tests are usually conducted by a GP, or often they're done at the IVF clinic if they're IVF patients.
Now read question 9. Now listen and answer question 9.
So then from a nutritional perspective, we do a comprehensive diet history or questionnaire with the patient just to determine any nutritional deficiencies. We look at both the male and female diets and check for possible deficiencies, specifically in, say, vitamin B9, B12, iodine, vitamin D, zinc and iron. These blood tests can give an accurate indication of vitamin D and iron, but the others can only be assessed through dietary information. We can conduct our own simple zinc taste test using zinc tally liquid, but we look primarily at these nutrients because of their importance in human reproduction. They're all essential to female egg quality and hormone production, as well as the sperm quality, quantity and motility. As well as these specific nutrients, we also must ensure they have a good intake of antioxidants in their diet, and often we prescribe them in a tablet form just to protect their cells from free radical damage and improve egg quality. Other important dietary factors include ensuring they have an adequate protein intake at every meal, particularly from fish and nut sources, and also that they're consuming good quality whole grains and a variety of different fruits and vegetables on a daily basis.
Now read question 10. Now listen and answer question 10.
If the patients are undergoing IVF treatment, we also pay consideration to their emotional state and how stress might be affecting their ability to fall pregnant. This is obviously a factor even if they aren't going through IVF. However, the process of IVF with all that anticipation and disappointment can be very stressful and certainly can take its toll on the patient's health and emotional well-being. We use herbal medicine to help calm and support the nervous system to reduce levels of anxiety and improve depression. We also use herbal medicine to safely offset the side effects of the various IVF drugs.
Now read question 11. Now listen and answer question 11.
I hope this gives a basic overview of what we do and how we fit into the health system in Australia. It's important to keep in mind that naturopathy is a complementary medicine, and the best complementary medicine must be interactive. That is, it should always work alongside and cooperatively with other healthcare practitioners, and the patient should also be actively involved in their treatment plan. There's no one system of intervention that will work for everyone. Neither is it reasonable to expect that a condition will always respond favourably to a treatment, even if this has been the case for many other individuals. In other words, every person must find a healthcare practitioner that will work for their best interests and who will treat them as an individual.
That is the end of part B. You now have 2 minutes to check your answers. That is the end of the listening test.